won't be correct. And then you're going to have to fill out all the paperwork, medication incident form and all sorts of things because you've got one of these 6 absolute rights wrong. All right? So it's a good idea to practice on a tissue how fast this drops. All right? After you've done your checks that you've got the right client, the right medication, the right dose, route, time and documentation, then the way that you administer eardrops is if Mary doesn't want to lie down on the bed, it's best if she just lies down. Remember that these eardrops go into the ear or ears at night time. All right? If you have a medication where it says right ear, 2 drops right ear, then you've got to really remember not to go into the wrong ear, which would in that case be the left ear. Or it might have 1 drop left ear twice a day. Always remember to look for which ear, because sometimes it's not both ears. In this case, you could actually do it in both ears. So I would lie Mary down, and I would, whenever you've got to put an eardrop in, you've got to actually hold a client's ear. Now don't hold it there because it's not going to help. Get it up here at the top of the auricle, which is called there. That's the pinner. Don't hold the pinner. And what you've got to do is you've got to actually pull the client's ear up and back. And it's like pinning their ears back. All right? Try it now. You'll find it feels quite good. And it's just a nice little feeling there. And what you'll find then is if she's lying down, you pull her ear up and back. And you pop your 12 drops in and then give the ear canal a little wriggle as the drop medication will actually then go down the ear canal and nestle against the eardrum. All right? And then Mary can get up. You can pop a cotton wool or a bit of tissue in, nothing sharp or hard, into both ears, and she can walk around after you've done that, just to repeat the same with the other ear. If she doesn't want to lie down, the best thing to do is to get her to sit sideways in a chair with a good back like this. So get her to sit like that and just put her hand there like that. So her head is quite horizontal, all right? And get her ear back and then you're good to go. So that's all you need to worry about with eardrops. Definitely remember to trial how fast the drop drops because you want the dose correct. Also, when you're checking the medication, read Waxol eardrops and then go and check expiry date. Whenever medication and expiry date go together, you're checking client, check allergies, all right? So the expiry date on the back of this bottle is 2012 and it's December 2012 for these Waxol eardrops, all right? Now, the next medication is a liquid medication that Mary is on. For a liquid medication, you actually need a graduated measuring cup here, like that. It's the most accurate form of measuring, rather than one of these, all right? You need to remember a couple of little things about doing a liquid medication. Adalat is actually for constipation. It's usually a clear yellow liquid, a clear white liquid, sorry, quite thick, quite sticky, all right? Remember, take your lid off and put it on your clean, unused surface, non-contaminated surface. You want to actually make sure that the label is uppermost so that if you get any drops, they're going to run down here and not onto the important information on the label. Make sure that you check that you've got the right client, the right medication. Make sure that you check the expiry date. In this case, it's June 2011. And then I want you to hold the medication up at eye level and pour out your 10 mils. Like that. Okay? Once you've done that, put it onto a flat surface, check the 10 mils, and you're good to go. Alright? You might actually want to wipe that over with a damp cloth if it does leak a little bit and get a few drops there. So that's Mary's Adalat syrup, and that's what you need to do to help her take that. What do you do if you accidentally pour more than the actual prescribed amount in there? Well, one thing you don't do is you don't pour it back into the bottle. You should never actually put medication back into a bottle of any kind, all right? It's sort of like a rule that only the pharmacist is allowed to put medication into a bottle so that we don't ever get anything mixed up. This is one of the few times that I would bend a little rule because at Activ we dispose of medication by sending it back to pharmacy. You can't dispose of that, so that would go down the sink, but I would definitely document very clearly what I'd done and justify why I had done it, all right? And there's nothing wrong with pouring a little too much and then getting rid of something, but be very, very careful to document what you've done and be very open about what you do, especially when medications are concerned. Alright, so the next medication that Mary's on is a difficult one. It's called Polyvisc eye ointment. Now, eye ointment is tricky, alright? And you've got to do the same checks as you would on anything else. With eye ointment, when you open it up, get the tube for the first time, and the first time you open it, you must actually put a little sticky label on and put the date that you've opened it on. Because in 1 month's time, it doesn't matter how much medication is left in that tube, you're going to need to get rid of it. Eye medication only lasts 28 to 30 days and then everybody has to ditch it. The reason for that is eye medication is quite weak. And if a bacteria gets in there, then it will breed. So we always get rid of it. The next thing that you have to remember, there's a few rules with eye medication, is that, say today's date is February 3? It's February 3 today, so remember in March 3 you'll get rid of it. The next thing you have to remember is the first part, put your lid down on your clean surface, the first part of the medication has to be disposed of. It never goes in the eye. So you put it onto your tissue without touching the nozzle. So the first bit of medication goes onto the tissue and nothing touches the nozzle, not even the tissue, alright? And from there then you can actually put the medication into the eye. Now I'm going to show you where to actually put it in, the medication into the eye. I'm going to draw a picture for you on the board of exactly where it should go. This is the eye here. You've got your pupil here. You've got your iris here. You've got your top lid here with the eyelashes. And your bottom lid, you actually got to pull down like this. And this is the inside of the eye. And the eyelashes are down here like this. Now the medication actually goes from where the colour starts here and it comes off where the colour ends. Alright? And if you look at that, when it says medication, it doesn't actually tell you dose. Because everybody knows that when you do an ointment, basically the dose that you put in always is just a thin line right across from there to there. Start at the inside of the eye, go that way and pull off. So let me just show you, and I'm going to pretend that this booklet here is the surface of somebody's eye. I take it out off the first bit, never let anything touch the nozzle, be really careful of that. Have somebody open their eye, pull it down, and I'll talk to you in a minute about how to do that to expose the conjunctiva. Put it in and then pull away. And really you won't have to put very much. You might see that's a very small amount. It's definitely not squiggle, 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 squiggle. It's just drop, move along, pull away. Okay? Now you might find that you've got extra ointment coming out of the tube like that. All you have to do then is never let anything touch the nozzle. The eyelashes must not touch the nozzle. Like I said, there's about 200 bacteria on each eyelash and we don't want to contaminate the nozzle. So once you've taken off the medication without touching the nozzle, let me just make sure I've done that correctly, put the lid on and you're good to go. Now how do we get the eye to cooperate? Because some people, everybody feels threatened when you come near their eyes or if you try and do anything in their mouth. It's just not a good feeling for anybody. So there's some little things that you have to remember. In order to get the eye down properly, do not pull down like that. It won't work. And in fact, you'll just give them a great urge to go out and have some plastic surgery by pulling down all the time on their skin like that. What you've got to do is you've got to get them to look up. You go in underneath the eye like that, and then it's a little rolling effect like that. So you roll down like that, and you should be able to see the pink in the eye and the conjunctiva. And that's where medication should go. Medication should not go anywhere on the eyeball. It's uncomfortable for people to have medication, even eye drops or eye ointment. It's much more preferable and more comfortable to go in the sac here, the conjunctiva, anywhere in there. Alright? So that's Mary's Polyvisc eye ointment. Now, you've got to have a very cooperative client to put eye ointment in. It can be pretty difficult. And if I had a client that does that all the time, I would end up ringing up the doctor and asking for eye drops or an oil-based eye drop rather than an ointment. I'm telling you the perfect way to do it. I realise that you're out in the front line there, but as long as you understand and know the principles and try and abide by them, you just do your best, all right? Okay, the next medications are PRN. So we've got Panadol, anticoral cream, and a puffer. Now cream, the Panadol is the same, and it will be in a different package. It will be in a PRN pack to this one, all right, which is a different colour. I don't have one here to show you, but it is done exactly the same as if you were doing medication out of the blue pack. So you would need your pill bop and all those sort of things. And you have to have that plan where there's a symptom of pain, what the pain is, and you have to do all the extra things that go with PRN medications. The anticoral cream is actually sorbolene cream, and it's used for dry skin. So if Mary's skin gets dry, then I would be applying that cream everywhere. There are some types of creams that you need to be very accurate with the dose. And if you need 0.1 of a mil or 0.5 of a mil, then the cream needs to be put into something like this, which has a base that moves. Whoops! So I'll just pick up the base. All right. That was a bit of a boo-boo. Okay, so the base moves up like this. Sorry, let me just get that right. And the cream's inside. As you move the base up, what you do is you take the cap off this syringe so that you can get a very accurate measure of cream. Take the cap off the little bottle, put your syringe in there, and as you move the base up, what will happen is the cream will rise up into the syringe, and you'll just then push down until you get to exactly what you want. It can be 0.1 of a mil, very small amounts of cream. Usually these types of cream are administered for hormone cream, hormone replacements and other types of things like that. But generally you won't see this too commonly around. It's generally just apply moderately or apply scantily, and you just have to make a good judgment of what that is when you're putting a cream on. Alright, now we've got a puffer here. Inhale 2 puffs by mouth every 6 hours when required if short of breath. So there you have your symptom, and this is the puffer. To administer a puffer for somebody having an asthma attack and they're short of breath, you need to put their lid down. Now remember, I told you asthma medication are actually powders. So you've got to shake it up like that, and then when you're ready, get the client to open their mouth. They can put their lips over it, or it can be just put at the entrance to the mouth, and as they breathe in, you do a puff like that. All right, and the person will breathe in and hold that medication in there, right? Now, unfortunately, with these things, when you puff, most of it's actually going to fly to the back of the pharynx. I don't get asthma in my pharynx, I get it in my bronchus. So I'm going to lose a lot of medication at the top of my throat with just a simple puffer. The best way to deliver this medication is to add a spacer device. Now, spacers come in all sorts of shapes. And that's how it happens there. You put that there. You just, first of all, you must remember, shake up the powder so it's flying around so you get a proper dose. Push it in there. The client will then put their lips over it and breathe in nice and deep. Now, if it's more than one puff is required, you've got to go through the same process all over again, but you must wait until they've had 4 to 6 breaths in between for the medication to take effect. All right. So I've already had 1 breath. Now I'm going to do it again. Shake it up again like that. Pop it in and puff away, and then they take another breath. And after that, you should monitor for how easy or difficult their breathing pattern is. It should get better. If it gets worse, you know you're going to have to get some medical help. All right. So that's that PRN medication using a puffer. And all puffers that are used, they're better off delivered in a spacer where as you breathe in, the whole medication